Okay, hi Bill, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. We've got some interesting things right off the bat to point out here. First thing is we can see there's quite a few areas that are frayed and kind of rough in the front of the shoulder. And we're using this instrument that you see there. It's called a shaver. It has suction attached to it. And we're just trying to smooth out some of these rough areas. Now your biceps tendon is here on the left side of this shaver, and the biceps tendon itself looks fine. Problem is, rotate me to 6 or 7. Problem is the biceps anchor is completely detached here. And we may have to deal with that. Right now we're just removing some of the cartilage just to try and create a nice healing area to put this labral tissue back down. Hold the camera, please. Okay, so that's cleared off. Now before we do anything else, I want to look around the rest of the shoulder. We're going to look towards the back. And this anatomy looks just fine. We'll look up at the rotator cuff. And on this side, anyway, the cuff looks pretty good. I'll put a marker stitch maybe right there when it's all said and done just to make sure there's nothing corresponding on the other side. But if that's all you have, then I think the rotator cuff will be okay. You can see a little bit of redness in the tendon right in the middle there. We'll investigate that as well. As we look down the front of the shoulder, we can see some frayed areas here that we can smooth out with our shaver. Pause, please. Okay, what we've done is we've placed a suture anchor in the bone here, and you can see the two sutures right here. And we're going to pass one of these around the back of the labrum just to secure it. Pause, please. Okay, so now you can see we've got the suture going around the tissue here. We're going to go ahead and tie a knot. And then we'll pass a stitch through the biceps and do what we call a biceps tenodesis. Hold it tight. Let me see. Okay, help me now. Okay, we'll finish this knot, show you some more in a minute. Okay, so now we've got that anchor down. It reconstructs the middle glenohumeral ligament there. And now we'll take a pair of arthroscopic scissors. Well, we'll take a spinal needle first and pass a stitch, through the biceps tendon. So what you'll see here is this needle coming down and through. put a suture. And then we'll do the same thing one more time. There, right through the middle. And then we'll sneak around the other side of the biceps to retrieve it. Oh, let's do it again. Okay, so that gives us a good hold of the biceps. We'll pull tight on the suture, and you'll be able to see how tight that is. Great, and now we'll take a pair of scissors, and we'll go ahead and release the biceps. And we'll do it right above where we put our other stitch. Okay, and so now we've got the biceps released. And I think we'll go off on the video and we'll get to work on the bone spurs. Pause. Okay, so what we've got here is this bone spur at the front of the shoulder. This is it hanging down here. We're going to go ahead and start the burr and remove it. And now we've got that spur pretty much smoothed out, so there's a lot more space in the front of the shoulder now. See if you can move that. Yeah, that cannula now moves a lot easier than it did before. So I'm definitely happy with the way that looks. Your clavicle is going to be over here. And we'll just make sure we got the spur from underneath the clavicle as well. Okay, so now we'll go ahead and look down at the rotator cuff. Pause, please. Okay, so here's the tear in the rotator cuff, and we're just opening it up so we can repair it. Come. Okay, so that's up to the biceps tendon. We'll put the camera in the front. And, I'm sorry, put the shaver in the front. We'll look towards the back with the camera. Pause, please. Okay, so we're just placing a spinal needle in. Look down to check our angle here. We know we want to place our suture anchor in somewhere around here. There's the articular surface. And then what we're trying to do here, that looks a little posterior, so what if we put an anchor in about here? That actually looks a little bit better, maybe a little bit too anterior there. So that looks pretty good there. We'll make a little nick in the skin. And then we're going to use this instrument that we just call a punch, just to pull back and make a little starter hole in the bone. Okay, so pause. That looks good. Okay, here's the suture anchor going down into the bone. Crochet hook. And that looks pretty good there. Just want to make sure we're down. And we'll unload the screwdriver. And you're going to see 3 different colored sutures coming off the anchor. We'll spread them apart. And it looks like we're going to start with the blue and white one. So we'll take it just like that. This is our suture hook here. We're going to reach and make sure we get this deep layer. We'll go ahead and load that and show you some more in a minute. Pause. Okay, we're just finishing the bicep sutures. We'll go ahead and cut the suture tails here. Because of the way that tear was kind of delaminated and split, we put in another stitch right here to close the split. But it looks good now. I'm very happy with the way that looks. We're going to go ahead and finish up and get you back to the recovery room shortly. So good luck to you now. Bye-bye.